let's go ahead and get started, because I think this one's going to be rock on, and we're going to have a lot of people like joining, because I think people still are figuring out that we are in fact incredibly prompt. And so I don't know, maybe in 2020 we started like 05. What happened?
Oh, I do have a conflict. I'm giving another webinar that night. I knew that was happening.
I knew you had one, but I didn't want to tell you.
I didn't want to, jump in on your schedule there. Okay, so let's get started. So I know we've got a few new non-faces because they haven't turned on the camera, but I do know that Angel is in her car. So for that perspective, for anyone else, please do turn on your camera if you can. So the Bridge Club was founded by both Brenda, raise your hand, shake, and and myself. I'm Catherine Hiskins.
Okay.
And
yes. Okay. And I don't know, you and I were talking back and forth.
I fixed it. I'm on it. So Brenda and I founded the Bridge Club as an opportunity to really bring important topics forward. And it does appear that over the course of the past 2 years, one of our hottest topics tends to always be around anything associated with technicians. And we love that because we do believe that they are the engine of the profession and really pull, yeah, look at Rebecca, yeah. And so we are really excited after having an in-depth conversation with Cindy one night about really how I learned her journey. I was unaware that Dr. Cindy Barnes was actually a technician first, built an incredibly successful practice where she actually put the technicians as the vital part of the practice. And it was an emergency practice that was incredibly highly profitable because she let technicians do everything that they could be doing. So it was one of the most exciting conversations that I had. And I thought, gosh, we got to bring this forward. We got to start showing the rest of the profession how to use technicians, how to be able to really leverage them. And in my conversations with Cindy, we actually reached out to NAVTA to find out like the percentage of the average technician and what they, what percentage do they do of their actual responsibilities, which she's going to bring up here in a minute. I was just shocked as we've been around the US having conversations, Brenda and I, how disparaging those, am I using the right word?
Disparate.
Yeah. The numbers are. They're so different all across the country. So it is with my great, great honor that I introduce Dr. Cindy Barnes, and I will have her, there you go, yeah, shake so people know where you are because it'll be different on everyone else's screen.
Right.
And I will kick it off to you, my friend, so we can start with the toast. So those of you,
yeah. All right. I've got my Bridge Club glass that I got at the Royal Canin Women's Leadership Forum. Thank you.
Yes.
So here's a toast to my fellow veterinary technicians. I still consider myself part of your clan. You are part of the veterinary team. We couldn't do our job without you. And, I really hats off to those that continue to push forward in the profession, that advocate for your profession, that don't give up, that know your true value. And to those that are just joining the profession, chin up, we're here for you, we're supporting you, and we're going to elevate you to the level you deserve. Cheers.
Cheers.
I almost said amen. That sounded so profound.
We can say that. Amen.
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 Okay, let's dive in, my friend, because we've got lots and lots to talk about.
Yeah.
Do you remember where we're starting?
No, you're just going to have to, help me out here. I got my notes over here, but go for it.
Okay, so actually I'd like you to share your story, the whole piece of how you got where you are. Yeah. But while we're doing that, if everyone can put into the chat, what percentage of time, yes, it is being recorded. Thank you, Rebecca. Everything is being recorded at the Bridge Club. So yes, everyone, this is being recorded and it will be shared with our all access members. Thank you. Thank you. If you could answer this question, what percentage of, if you are a technician, of your roles and responsibilities that is designated by you, what a technician can do you actually perform? If you are a DVM, what percent do you think that of the roles of your technician they actually perform in your practice? So just put those in the chat as we're talking.
All right. Well, so, I hate talking about me, but I have started in the veterinary industry in 1995, I believe, as a vet assistant, and went to school at Mount San Antonio College in California and became a registered veterinary technician and started in a day practice, moved my way up to emergency and critical care, worked at a highly functioning advanced practice in Southern California, where we did, ventilation cases and hemodialysis, which I think UC Davis was the only other location doing hemodialysis. And I was lucky enough to work on some of those cases. I've run emergency hospitals as a vet tech and started my journey towards becoming a veterinarian when I was volunteering time with Rural Area Veterinary Services, or RAVs, back in the day. And was teaching the vet students anesthesia, and basically I was encouraged by the director of that program to go to vet school. And now I had 5 kids at the time, and that just didn't, and I was older, so that didn't seem like it was, reality based, but I talked to my husband and he encouraged me, and I went ahead and enrolled in school and put my son in preschool at the community college I went to. And, the rest is history, as they say. I got into Colorado State, moved my entire family that had only lived in Southern California out to Colorado, yanked all my kids out of their schools, including my oldest daughter, who was going into her senior year. My oldest child had just entered the Coast Guard. And so it's been an interesting journey. And out of vet school, I started a large animal ambulatory practice in Montana, and my husband put a kibosh on living in Montana. We thought that was our dream state, and in reality, we just didn't like it. It wasn't. Summers are gorgeous, and we would love to go there every single summer, but winters not so much. So we kind of bounced around a few times. I worked in a day practice as a veterinarian. I worked at a biotechnology company's ranch, taking care of 15,000 goats and 3,000 New Zealand white rabbits and 30,000 mice and a herd of Gelbvieh cattle and, quarter horses. And I mean, I've done it all, and it ended up in Prescott, Arizona, where I purchased an emergency hospital and became, a 24/7 emergency animal practice. And I knew going into that operation that I was going to do things differently. I've worked in every environment. I've seen highly functioning teams. I've seen very poorly functioning teams. I've seen the toxic workplaces, and I've had great leaders and I've had very bad leaders. And I just set the standard when I hired my team, and that's what got me to this place today.
Well, and I think it's a good jumping off point to then kind of looking at these numbers. First of all, Angel, wow, 80%, that is amazing. And Clara, 85, and Lorraine, I hope I'm saying Lorraine's name correctly, 75%. So there's folks on the phone or on the conversation tonight that I'm going to be eager to have you jump in here in a little bit after we talk with Cindy on ways that she believes that can really help elevate practitioners. What have you done? Because I think this is huge. Those are amazing, amazing numbers. Mary, I think when Brenda and I have done our conversations, we've heard more of the 30. So this is huge. So
they're the outliers, but we need those outliers because those are the mavericks of the industry that are going to go and advocate for our technicians.
Absolutely. So let's dive into when you and I had a great conversation. There are 3 main ways that technicians can be truly changing the profitability of a hospital if they were utilized in a different manner. So I'll let you dive in.
Yeah. Well, so these are things that I implemented in my practice. Not so much the third thing because it was emergency and we didn't see appointments, but my top utilization tool would be to allow the technicians to develop relationships with the client, you know, before the appointment, during the appointment, and after the appointment. So the whole process of triage, you know, taking the history, getting your vitals, collecting your data, you know, developing a conversation with the client and a relationship, finding some sort of common ground with that client, you know, in those first few minutes that's going to set the tone for the relationship, kind of prepping them for what to expect when the doctor comes in. And of course, technicians don't ever suggest towards diagnoses, but they can certainly kind of talk about what possible outcomes are going to happen, you know, after the doctor comes in. So, you know, the doctor will come in and do their physical exam and make their recommendations. And at that point, I allowed the technicians to go in and go over the diagnostic estimate and the treatment plan. And because my technicians were super educated and empowered, you know, that definitely comes across to the client, and the client believes in what this technician is saying and respects what they're saying, almost to the point where they ask the technicians, well, what would you do, you know, over the doctor? And then once that estimate or treatment plan is approved, the technician, in the end of the appointment, this, you know, obviously there's lots in between, but at the end of the appointment, the technician is responsible for going over discharge instructions, follow-up care, and what to expect next. So basically, the entire appointment is run by the technicians, freeing up the doctor's time to go ahead and go on to the next room, or spend more time with, you know, a client that may require, or a case that may require more time. And that's just kind of the tip of the iceberg on how your technicians increase efficiency and profitability in the practice. So that's one. Two would be, of course, to allow the technicians to do absolutely everything that they are credentialed to do and trained to do. So I say trained because not every technician, just like not every veterinarian that comes out of vet school is trained and ready to do every procedure. But assuming you have a highly functioning team that you've invested in, allow them to do everything that they're credentialed to do. That frees up your time to do simply physical exams, diagnoses, surgery, and prescriptions. That's the only thing that doctors are required to do by law. Everything else a technician can do. And that's going to allow your doctors to spend more time with clients or see more patients in the same period of time. All of those things result in higher profitability and better medicine, better outcomes. So the third utilization tool that really I think is the most underutilized in the industry are tech appointments. So this is something I did as a technician for many, many years. And now it's, for some reason, become a very controversial topic. And thankfully, Banfield is kind of leading the charge here and scheduling tech appointments. So technicians, you know, it's twofold. One, technicians can, you know, allow your practice to increase profitability by all the other things that we talked about a few minutes ago, but they can also be revenue generators through tech appointments. So a tech appointment can consist of, you know, obviously the standard stuff, anal sac expressions, nail trims, bandage changes, but they can also do physical exams, which is simply data collection. They can do vaccine boosters. This is all with the assumption that there's an established VCPR between the practice and the patient, the client. But they can booster vaccines on healthy animals. They don't diagnose the animal as healthy, but they collect the data, and the doctor, who is the doctor on duty, can overview or take a look at the data and determine, based on the data collected, if that animal is diagnosed as healthy. If there's anything found on physical exam that requires a doctor, then that appointment turns into a doctor's appointment. But vaccine boosters and follow-up injections for, you know, chronic conditions such as Addison's or Cushing's or diabetic, you know, testing, subcutaneous fluid therapy, those are the things that do not require the doctor's time to be spent with the client. If you think of it in terms of human medicine, the majority of all of the work is done by your registered nurses. And even things like recheck lab tests can be collected and submitted by the veterinary technician, and then the results can be reviewed with the client, with the doctor, you know, at a later date, later in the afternoon, over the phone, via telehealth. And so, yeah, that kind of summarizes the top 3 ways that you're going to use your technicians in practice to increase efficiency and profitability. So relationship building, you know, allowing the technician to do absolutely everything besides those 4 things that a DVM is required to do by law, and tech appointments.
So this is great because we're already starting to get some questions coming in, and so let's jump in, and Angel, let's take yours as we're looking at this one. You know, we struggle as a clinic with charging for these visits. Currently, we only bill out the item or the treatment only. What are your suggestions for that? Because you're a profitable one. Let's do this right.
Yeah, absolutely. Well, you know, you can certainly charge for a tech appointment. You know, you're charging for their time, and I would call it a tech appointment, or an office visit. It's not a doctor's exam, and, you know, but it is a billable item, service. So absolutely. I mean, I'm not going to tell you what to charge. I would poll the industry and figure out what people are doing, but it's going to be less than a doctor's appointment, but you definitely need to charge for it.
And what
Plus all of the boosters.
What does Banfield call theirs?
Tech appointments.
They are called tech appointments.
Absolutely.
Interesting.
So, you know, it's guided by your state's practice act, but the state's practice acts are not comprehensive enough. They're a little gray in this area. They don't go into too much detail, but basically registered or credentialed technicians can do full physical exams. And if the doctor signs off on that physical exam as being, you know, apparently healthy, they can go ahead and do all the things that we talked about earlier. So, but definitely familiarize yourself with your state practice act. I think California is about as strict as they get, and they're doing it in California.
So another question coming in is, there's some talk in the industry that veterinarians should be the one presenting and discussing estimates with clients rather than the technicians. What are your thoughts on that?
I am 100% opposed to that. And the reason for that is because there's multitudes of reasons behind that. But basically, you want to remove the doctor from any association of revenue generation. The only thing the doctor needs to be doing is recommending what their diagnostic plan and treatment plan recommendations are based on physical exam and history of the patient. That way, the client understands that those recommendations are solely based on what's best for the pet and not what's best for the doctor's bottom line. So when you remove yourself from that element, when when clients are always asking, well, what do you think this is going to cost? Well, okay, so what's this going to cost me, Dr. Barnes? And I will always say, you know, I don't know exactly what the cost is going to be, but we're going to present you with a comprehensive treatment plan before we do anything, so that you can discuss that, you know, with your technician. And if you have any questions that they can't answer, I'm happy to answer them for you.
So Cindy, you're extraordinary at empowering other people to do things and to have strength. That's, I think, one of the reasons Catherine and I were so excited to have you on the Bridge Club tonight too. So what would you say to those technicians and veterinarians who are with us tonight who don't have that support, or don't know how to give that support?
Yeah, absolutely. Yeah, I thought about this quite a bit. And I hired a bunch of technicians that I'd worked with in other practices. They moved to, they moved to different states, moved their whole family to come work for me. And so here's the thing. If you work for a practice that doesn't empower your technicians, the best thing you can do is present them with data. Give them data. There is so much data out there on the benefits of, you know, hiring or utilizing a credentialed veterinary technician. I mean, the data from 2008, you know, the AVMA's biannual study was, for every credentialed technician a practice hires, per practice, they generate about 160,000 in revenue. So, you know, Dr. Furman and I crunched the numbers since she's got an MBA. And, you know, when you adjust that for inflation, 3% over the 11 years, you know, that's over $200,000 in additional revenue that a technician brings to your practice. And how is that generated? That's generated through freeing up the doctor's time, just like I talked about. The doctor can see more patients. The doctor can spend more time with those needy clients that really need hand-holding in order to give their animal best medicine and better outcomes. And so educate yourself, then present your practice with data, you know, and especially if you're talking about income generation and increasing productivity and decreasing the stress of the veterinarians to, you know, give them, you know, better quality of life, empowering your staff to give them a better quality of life. That's the best way to start, is just through information. And when your practice hears your conviction, you know, if they hear your conviction and they see the information you've collected and the data you presented, and they still dismiss you, then that's a practice that maybe you shouldn't be in. And, you know, I tell technicians all the time, you are so valuable. Like, you're so valuable. And I don't think the general population gets it, because we've been told, you know, this technician and this technician, one's credentialed, the other one's not, but they all do the same thing because there's no oversight, no regulation. And so therefore, you know, we're going to train someone off the street, which is not a horrible thing, but I think that there has to be, you know, some sort of designation between what credentialed techs do and what vet assistants do. They work together in harmony with the veterinarian, and everyone can profit from that. But technicians, if we didn't have credentialed technicians that were highly educated and contributing to this industry would die. We already have, of course, a huge veterinary shortage, but really, you know, many people that I talk to agree with me. We have a technician shortage. We don't have necessarily a veterinary shortage, because, you know, I personally can run, and maybe I'm an outlier, I don't know, I don't think so, but I personally can run 4 exam rooms, no problem, if I have the right staff ratio. Whereas some of these practices have this really high doctor ratio because they think they need the doctors in order to, you know, see that many patients. The demand is there, when really the amount of time they're spending in each appointment doesn't need to be, you know, 15 whole minutes or 30 whole minutes. Most of that time can be spent with technicians, and they can go into the next appointment. So
I'm going to do this really quick, and then we'll start the after party, because that's, for those of you who've been on the Bridge Club before, you know that we promise you 25 minutes, and if you need to exit, you certainly can. But we're going to move into the after party, and I think that Pam's comment that she just made in the chat is really pivotal to a story that I did and was hopeful that we would have time for you to share. But before we get to that, I did want to find out from, you know, our group of great gathering here, from whether it's Pam or it's Clara, or, you know, as we go through and look at from Angel's perspective, what are your practices doing to utilize you so well? I mean, these are, as Cindy said, you guys are the outliers, but we got lucky to have you on here. So I'd love for you to chime in, take yourself off the mute, and let us know how your practices utilize you, because I think that'd be fantastic. And just chime in whenever you'd like. No
or
pressure.
raise your hand if you want to be called on, right?
That's true.
I'm going to click on this. Oh, here, I'm going to click on this chat and see what the questions were.
I'll go.
Go ahead.
Imagine that. So when I responded to the question, I thought the question was, how much do you feel veterinary team members, technicians specifically, are being utilized within a practice?
Right.
And as a generality, using the 20/80 rule, I think veterinary technicians are only being utilized 20% of the time as to what they truly can do. Now, I was very much empowered as a veterinary technician in my rural practice in the 80s and 90s. I didn't know at the time how empowered I was. So we actually had a consultant come in, and I went to lunch with Tom Catanzaro yesterday. So at the time in the 80s and 90s, he explained to my veterinarians who sought the consult of a veterinarian who wanted to elevate their practice. And at that point in time, we were being delegated and leveraged to the max, even within rural Colorado in a mixed animal practice. So we've got an enormous amount of potential here, and it's wonderful to see that, yes, these folks are being leveraged to the max. So I'm going to mute and say that, yeah, there's so many things that we can be doing, as Cindy said, to support our veterinarians in what they're trained in: diagnosing, prescribing, surgery, and I'm missing the fourth one.
Just physical exam.
Everything else the veterinary technicians can do.
Go ahead, Mary.
I hope you can hear me. I'm having some problems with the audio at times with this. And when I said 30%, I cheated because I'd actually done this through a couple other presentations. So just bear with me. Yes, I cheated. When I was in practice, however, we were really well utilized in the practice I worked at. We did all of the history taking, start the blood draw, start all the lab testing and all of that. We did exactly what Cindy was talking about. So we were very well used when I was in practice. And I agree, it is up to the technician to take the reins of their own career and get the CE that they need to do. And if they have an interest in pursuing an advanced training protocol or something like that, they need to figure out a way to get that and talk to their veterinarians about how helping them with that CE would benefit the practice in the long run. So I think I see a lot of practices, however, I'm in practices all the time where the technicians are not utilized fully at all. And they're basically glorified animal assistants. And that really is hard for me to see. And it's also hard for me to say, why are you here? If this isn't where you're being fully utilized to what your degree allows you to do, why are you still here? So, but that's just, I just wanted to fully declare that I cheated on that answer. So I will let somebody else talk now.
Well, we're getting such great stuff in the chat, and I recognize and appreciate everyone not being able to chime in today, but I really want to make sure that we're bringing these forward if people don't have their chat open.
I don't, so go, and I don't have my glasses on, that's
quite all right. So Pam had indicated that we are in a very large specialty practice with 35 plus DVMs and almost 100 RVT / assistants. We use our nursing staff to their full potential and keep it going. So that's awesome. So huge for what Pam's got. Clara says, currently I'm a practice manager. Love our practice managers. Shout out to you all. We still train our vet assistants, do anesthesia, handle grumpy animals. I'm always willing to learn something new and love to take on new tasks. So yeah, let's see what we can do to elevate that even further. Angel had indicated can't do audio. That's right now. That's fine where they're at. But our techs are very much utilized, as Dr. Barnes mentioned. Our goal is to get our techs doing more of what she describes, doing pre-exams and charging for tech appointments. I love this tech appointment thing. I think it's just beyond brilliant. And then Lorraine, I'm hoping I'm saying that right. I apologize if I am not. I work in academia, anesthesia, and in recent years, the younger generation, I find this interesting, the younger generation of students have complained about learning from techs instead of the clinicians. We run about 35 cases per day. just in small animal, working one-on-one with a clinician is just not possible. How is this attitude reflected on the new graduates in the industry? Does anyone know?
Well, first of all, I have a very strong opinion about that type of attitude. I think, you know, in academia or any practice, the culture has to come from above. So whoever is running that, you know, that school or, you know, academic environment, they need to be the ones that advocate for the extensive training, extensive knowledge that these technicians have, and that these vet students are blessed to be able to learn from these technicians. And that attitude and that culture has to come from the leadership. So that should be nipped in the bud immediately.
And I'll say, for those of you, we do have on Thursday, Dr. Andy McCabe is going to be talking about the state of veterinary education, veterinary medicine education. And so it's an opportunity. I think we should bring this question forward. I think would be fantastic. So lots more. Love all this because I can't talk, so they're using the chat. So, it's engagement. We love it. We love it. So Pam also said we hire assistants to team with our higher level techs. Oh, it just rolled down because we have more people. As they are harder to come by, and then they are trained up as bench strength, who will eventually fill those high level, and when those high level people move on. I love that philosophy.
That is the way it should be. You should have, you know, the least amount of doctors. Next will be, you know, your technicians. Every technician, credentialed veterinary technician, should have 1 to 2 assistants to help them with restraint, with running lab tests, you know, and assisting in all the things that the technician should be doing. So the technician needs their own assistants. The veterinarian needs their you know, team.
So it's a pyramid, really, Cindy, right? You've got the veterinarian, fewest at the top. Then you have your layer of your, you know, very well educated technicians, and then you have your assistants. So it's all.
Absolutely. Absolutely. And, you know, things like anesthesia should be only performed by credentialed veterinary technicians, you know, with the assistant, you know, the assistant holding. But anesthesia monitoring is, you know, I mean, think about that. Would you want an unlicensed, you know, technician or assistant running your anesthesia in human medicine? No. So that's something that should definitely be done by a credentialed technician that's competent in that skill. But, you know, assistants can certainly help out. So they can be taking information, recording results and things like that, you know, placing probes and whatnot and making sure things are functioning correctly. But basically the ins and outs of whether or not that animal's at the proper level of proper plane of anesthesia and oxygenating well, and there aren't any issues with, you know, the vital signs, should be done by a credentialed veterinary technician.
And Rebecca, did you want to add something onto that?
Well, it comes back to the idea of the Practice Act, and even the idea too of indirect and direct supervision, being clear as to what that looks like, which I think was going to be leveraged more in the technician appointments, what they can and can't do. So you have to really understand that, yes, veterinarians are governed through their state Practice Act, and that really helps to dictate what can go on within practices. But from learning about that and really understanding it, it really can leverage your team even higher once you step over those fears of what does this look like.
Yeah.
I encourage.
Absolutely. Absolutely.
Yeah.
And I applaud Banfield for kind of pushing those boundaries and seeing, you know, where those gray areas fall. I mean, I don't think they're pushing the boundaries that much, but they're definitely, you know, saying, hey, we all should be doing this. And this is how we're going to deal with the quote unquote veterinary shortage. And it's working really well for them.
So I want to make sure, because Pam's brought it up a little bit twice in little nuggets here, and that is the investment into the technicians and what this means specifically for the culture of the practice and what this means for education across the board. So can you share in our last little bit before we do a parting thought of kind of your philosophy with regards to this and what you did in your practice? Because this is one of the things that make you a true advocate.
So, you know, I was all about giving my team every tool they needed, both tangible and intangible, to be successful. And so that included sending every team member, including the assistants, to continuing education every single year. That included giving them the physical tools they needed to do their job, that were in good working order. You know, blood pressure machines, pulse oximetry monitors, so on and so forth. We even implemented the non-invasive temperature probe thing. I don't know what you want to call it, made by Nokia. And it was very, very accurate inside the ear canal. And so I invested in my team heavily. I had Kenichiro Yagi come out to my practice. We would spend 2 to 3 days every year with intensive training. They would, my team would learn how to place NG tubes, how to place arterial lines, how to take arterial samples, interpret blood gas analysis so that they can, monitor that patient under anesthesia. We would, they were all highly skilled in recover CPR. I bought cadavers for them to learn CPR on. This is before Ken was, at the simulation lab at Cornell. So we used cadavers, which are available to purchase. And I really invested in my team. And what happens when you invest in your team and you empower them is that they are so proud of their knowledge. They want to share that knowledge with their clients. They have no problem presenting estimates of any size because they believe wholeheartedly in the medicine that they are advocating for. So the whole team wins. The doctors win. The technicians are, engaged and excited and have fulfillment in their job. And, clients have great relationships with these technicians, and ultimately best medicine prevails.
So we've been getting some really good additional, and I just have to really thank everyone for all of the comments in the chat, because this is awesome. But Lorraine had asked, are techs in private practice permitted to perform epidurals and ultrasound guided local regional blocks? And I know it varies by state, but I figured like Mary, you probably would know really well.
Go ahead, Mary.
Oh, she's got to
unmute. Sorry, I had to unmute. Yeah, most of the time they can. Again, it does vary state by state. I primarily only care about the dental blocks. The rest of that stuff scares the daylights out of me. But yeah, I mean, I teach technicians. In fact, I'm doing that tomorrow in Kansas City to do blocks. So I think it just varies by state on what they can do. I know a lot of technicians who are placing epidurals on a daily basis. So
absolutely, I think
some states may frown upon it, but most of them will do it.
Unless it's explicitly outlined in the Practice Act, it's a gray area, and most progressive specialty surgical practices are having their technicians place epidurals. That's something a technician can absolutely do.
I've placed one and I was scared to death, so I'm good.
I know we're running low on time, but there's one I'm sorry, Joy, go ahead.
When I worked in anesthesia at Colorado State University, the technicians were doing both epidurals and also ultrasound guided blocks, like a saphenous nerve blocks and so on.
Yep.
And so forth.
That's cool. More power to them. I don't want to do that.
So we are running close to quitting time, but there's a comment in here in the chat that I just thought was really interesting. I would love to get feedback from people. It was relative to the continuing education. And if you give a technician or an assistant the financial support to get CE, are they required to sign a contract or make some kind of commitment to the practice? And some do and some don't, I'm sure. So I just thought I would put that out there real quick for commentary from those of you in the group, and to see if you believe that is important to do if you're investing in them.
I'll just give you my perspective,
Okay.
and then I'll turn it over to everyone else. So for me, no. I'm all about, if you want to be on my team, I'm going to give you every tool you need to be successful. I'm going to support you. I'm going to empower you. And we're going to have a great time. Those that, you know, didn't work well on my team, you know, they basically were, they found other places to go. And I, you know, there were times when I invested quite a bit of money into technicians, and it turned out that they weren't the team members that I needed.
Mm-hmm.
And so they worked really well in other practices. But, you know, I don't put any obligations on my technical staff, just like I don't put any, I don't put contracts on my doctors. It's, you know, it's my job to keep my team happy.
Mm-hmm.
You know, if I give you all of this education and all this training and then you take and go somewhere else, then I've failed.
Yeah.
And I have to agree 100% there with Cindy. I don't think I think if you invest in them, that shows them that you want them to stay. I don't think you need to have a contract then with that person. And then, as you said, if they're not a team player and they move on, then that's actually probably better for your team in the long run.
Absolutely.
But I really think if you can show them that you're willing to invest in that whatever they're doing for education, I don't really, you know, it shows them they really want to stay there because you care about them.
Yeah, absolutely. It's a win-win.
Very win-win. Very win-win. What is this? Okay, paying for tax would be cheaper if vet school is tough for us. We'd be happy, a knowledgeable team, but how come there's no personal investment? Well, I think that's it. And then she said, are you paying for vet school too? Or Angel said,
that would be
well,
quite an investment in the team.
that would be
to be determined. It is possible for practices to pay for technicians' student debt and their doctor's student debt. It is possible. Just like it's possible to pay your technicians a good living wage of somewhere between $25 and $40 an hour and still be profitable. So that's for another day, but stay tuned. There's big things coming.
Oh, I like hearing that one. Well, with that, guys, so I do want to be sure we're always very cautious on time. We've got people on trains, we've got people, you know, trying to get home. We've got all that. So we want to be really conscious of that. So parting shot, my dear friend, what would you like to leave as your parting thought and toast?
Oh my gosh. Well, I think the one thing that I know I need to grab my glass, but I drank all my wine. I think the one thing that I just want to
probably
I want to hammer home to the technicians and all of the support staff, you know, that are watching us, and the doctors. I mean, our whole audience, is that our technicians are so valuable. And when you actually take the time to realize that, you as technicians are going to advocate for better pay, better working environments, better equipment, better cultures. And when those things don't come to fruition, you move on because you are valuable. And practice managers and doctors that are in the audience, you need to understand how much your technical staff can support you in your burnout and your compassion fatigue and your extra hours. And, you know, if you're paid on production, you know, they can crank up your production like no one's business, because you're going to see so many more patients when you utilize your technicians. Mm-hmm. And yeah, I mean, it just is going to take a groundswell of us kind of being the mavericks and saying enough is enough. This is what we are going to stand for, and this is what we're not going to stand for. And more opportunities to speak to audience like this through organizations such as the Bridge Club. So thank you so much for having me and advocating for our credentialed veterinary technicians. Cheers.
Everybody.
Cheers.
Cheers, everybody.